So, if you're a psychologist, counselor, pastoral worker, social worker, or just generally interested in the influence of our emotions and spirituality on physical pain, don't go anywhere. Because today, in episode 5 in the series PEP Talks on Pain in Children, we're going to look at emotional and spiritual pain in addition to physical pain. Welcome from me, Annemarie Oberholzer. I hope you are as excited as I am to explore the fascinating link between the different dimensions of pain. How many of you know Cicely Saunders? Oh, she was a remarkable person, qualified as a nurse, social worker, as well as a medical doctor, and during the late 1940s, she founded the first modern hospice to provide palliative care to patients, promoting the principle of dying with dignity. Working with terminally ill patients, she defined the concept of total pain as the suffering that encompasses all of a person's physical, psychological, social, spiritual, as well as practical struggles. Now remember, I've previously referred to pain as the alarm system of the body. As the main function of the human body is to survive, pain plays an important role in warning against anything that might threaten the optimal health and survival of the body. And this is true for physical pain, emotional pain, as well as for spiritual pain. And all pain has a function. We experience physical pain to ensure that we rest an injured body part and don't, for instance, keep on walking on a broken leg. Instinctively, we know that we need other people for survival, so we experience emotional pain to ensure that we don't disconnect with other people. Emotional pain, also referred to as social pain, can be described as a negative emotional state that arises from social injuries or from perceptions of interpersonal rejection or loss, such as unrequited love, a relationship breakup, or the death of a loved one. Do you know what the number one fear of people is? Oh no, not death, public speaking. And why is that? You see, when we put ourselves out there, we stand the chance of rejection. And deep down inside, we know that rejection by the people around you could diminish your chances of survival and even be life-threatening. I'm sure it's safe to say that the biggest comfort we can give another person is simply to be with him or her. We don't only experience emotional and physical pain, but also spiritual pain to ensure holistic well-being. Now, there's a number of different interpretations of spirituality, but through intensive research in the area of spirituality and health, I came to the conclusion that our spiritual needs can be defined as the need to experience connectedness, that is a relationship with God, the sacred, the environment; transcendence, to experience that which is beyond the normal or physical; the need to find meaning and purpose in life; and the need for harmony and virtue. It is important to remember that spiritual needs are universal human needs. In other words, needs that children would also experience and should also be addressed in healthcare. Although all indications are that spiritual pain can influence and be influenced by physical pain, there is limited research on this topic. However, the link between emotional and physical pain is a hot topic for research at the moment, with a number of very interesting studies linking these two dimensions of pain. Oh, if you think about it, even the pain language we use overlap. We will talk about heartache, broken hearts, or even refer to stabbing pain when discussing emotional pain. This started to make sense when the researchers showed through functional MRI studies that social rejection pain and physical pain are processed in the same regions in the brain. They state that it gives new meaning to the idea that rejection hurts. The anterior cingulate cortex is one area associated with pain and suffering, regardless of whether it is social or physical in nature. Panksepp explained that the anterior cingulate cortex is associated with separation distress calls in animals as well as feelings of sadness in humans. This author concluded that it is a warning system of the body so that people can seek social support when pain from social loss occur. A cingulotomy, where they remove a portion of the anterior cingulate cortex, is not a very common procedure today and only performed as a very last resort. But a study done in 1968 by Foltz and White found that when this procedure was done in chronic pain patients, the patients could still identify the source and location of pain, but the pain did not bother them anymore. The same procedure is also used for severe depression. Another interesting study concluded that people who are more sensitive to physical pain are also the same people who are more distressed by social rejection. You will also find that medication regulating one type of pain will regulate the other kind as well. For instance, it was found that opiates also reduces the pain of social separation, and antidepressants are used as an adjuvant to treat chronic pain. The International Association for the Study of Pain also includes the concept of sensory and emotional experience in their definition as explained in a previous video. I've also explained how stress and anxiety can increase pain, but let's recap quickly. In a stressful situation, the brain needs to get as much information as possible about the environment causing the stress to determine the severity of the stressor. It increases impulses going to the brain, and this is obtained through the secretion of certain neurotransmitters. For instance, substance P will increase pain impulses to the brain. It also increases brain activity in the area processing pain. All of this in order to be able to make an informed decision on how to protect the body. Well, the problem is that some non-painful impulses can be registered as pain. For instance, we often see this in children before a medical procedure. Before any pain should be present, children will start to display signs of pain, crying, screaming, even when a tourniquet is applied around the arm. And this is not an attempt to manipulate the healthcare professionals, but because they really experience pain from the tourniquet if the situation is extremely stressful for them. So why is hospitalization and medical procedures so stressful and potentially traumatic for children? Remember, they have different thought patterns than adults. Children see any pain and suffering as punishment for something they did wrong. They also have concrete thoughts, meaning they would form a picture of anything you say to them, and the abstract nature of illness could potentially lead to a variety of misconceptions. Children also have limited life experiences that would also contribute to misconceptions, such as the 6-year-old who thought that he was going to die during a minor operation because his father passed away in the same hospital a few months earlier, and that was his only experience of anyone ever going to hospital. Or the 5-year-old who was having a hard time coping with going to the clinic for an immunization because she believed she was going to suffer the same fate as her dog, who was put down by an injection. What is common sense for us as adults is not the same for children with their limited life experiences and their limited understanding of their own body, of illness and or the reason for certain procedures. Adding to that a strange and potentially threatening environment, and you have a recipe for disaster. Let me read to you from the book Trauma Through a Child's Eyes by Levine and Klein about the hospital experience of children. Without appropriate support, children do not have the inner resources to comprehend the blinding lights, physical restraints, surgical instruments, masked monsters speaking in garbled language, and drug-induced altered states of consciousness. Nor are they able to make sense of waking up alone in a recovery room to the eerie tones of electronic monitoring equipment, the random visitation of strangers, and possibly moans of pain coming from a bed across the room. For infants and young children, events such as these can be as terrifying and traumatizing as being abducted and tortured by revolting alien giants. That is why it is so important to equip children with adequate knowledge to properly educate them and to prepare them for any and all procedures and healthcare interventions. And this should be done in a way and language that children will understand, in other words, in a concrete way, using suitable pictures. And with a focus on combating fear and anxiety in the child so that he or she will not experience unnecessary pain. I will explain in more detail how to prepare children in a later video. So we've looked at the link between emotional and physical pain, as well as at the influence of children's emotions on physical pain. So is there a link between physical pain and spiritual pain? Well, research are limited and there aren't any specific studies that include spiritual pain. However, a very interesting study that included adults confirmed that religious people experienced less pain during a painful stimulus when they were presented with a religious image that were particularly meaningful to them. Furthermore, numerous studies show how important spiritual support is for children in coping with hospitalization, such as that children with cystic fibrosis reported a variety of religious or spiritual coping strategies that are associated with adaptive health outcomes, or that keeping hope alive and finding support in religion are two of the coping strategies most often used by children undergoing chemotherapy. These authors remind us that children have a rich and complex spiritual life, and although spiritual beliefs have the potential to support children's ability to cope with chronic illness, certain beliefs and misconceptions could sometimes have a negative impact. And for that reason, it is actually very important to include spiritual assessment as part of the nursing care plan when children are admitted to hospital, but that is a topic for another day. The problem with modern healthcare, though, is that the focus is on the physical care of patients. And as Puchalski observed, patients are seen as a disease that needs to be fixed quickly and cheaply, rather than as human beings with complex needs. And children are very perceptive. Children might forget what you've said, but they will never forget how you made them feel. As a 5-year-old commented after hospitalization, "They looked at my ears, they looked at my throat, they looked at my tummy, but they didn't look at me." This episode concluded our introduction and background and laid the foundation for the next few episodes, where we're going to look specifically at the assessment of pain, as well as the management of pain in children. It's going to get really interesting, so please make sure that you don't miss any of the upcoming episodes.